Hi, my name is Morgan Sigler.
Hi, my name is Brooke.
I'm Maya Horton. We're all nursing students from Salisbury University. So the app that we have to present to you today is called On the Go. Starting out, I just want to ask everyone, have you ever cared for any patients with pneumonia or known anyone to ever have pneumonia? Please raise your hand. Thank you. So I want to show you some statistics. So 1 in 5 patients with pneumonia is readmitted within 30 days back to the hospital. It's a lot. It's 20% of patients. And then pneumonia is responsible for close to 140,000 hospital readmissions per year, costing more than $10 billion in hospital expenditures. It's a lot of money. So most of these patients are over the age of 65. When you're over the age of 65, you must sign up for Medicare. And Medicare will not reimburse the hospitals if the patient is readmitted within 30 days. So our app aims to create a comprehensive discharge checklist, and that will allow the members of the team to communicate together, because discharge is often put on the nurse. Due to short staffing, medical emergencies, anything can arise, patients are often handed a discharge packet or papers. Now that might not even be in the language they speak, it might not be in a big enough font, and you have to take into account their health literacy level as well. So our goal is to compile that all into one app and give patients access to that as well.
Okay, just like Morgan said, this app On the Go is really tailored for healthcare professionals. It's designed to make the healthcare team move quickly together. It's designed to make the healthcare team work better together, because they're each going to be able to add to this checklist. So that includes respiratory therapy or nurses or doctors. They're each going to have their own checklist that they can check off before the patient is discharged to make sure that their patient has all of the resources that they need before getting discharged. These resources can also include education on other comorbidities that they might have, like pre-existing diabetes or COPD, not just pneumonia discharge care instructions. They can also include videos specifically for if they have pneumonia care, they might need to use the use of an incentive spirometer, and there could be videos included showing patients how to use that, because the typical patient, if they're not taught it through a video, may not be able to read directions and see that for themselves. The video also, sorry, not the video, the paper as well, the app itself also can show people the different literacy levels, so you can change it based on your literacy level, can have a bigger font screen accessible to computers or phones. And then patients who receive all discharge instructions are less likely to be readmitted than those who miss at least one instruction. And patients who clearly understand their discharge instructions have more than 30% lower odds of being readmitted. This is crucial, because the problem we are trying to solve is decreasing readmission rates. And the way that we're going to pay for this problem and how it's going to work within the hospital system is, right now, when people are readmitted for pneumonia or other specific comorbidities over the age of 65, Medicare will not pay for those readmissions. The hospital has to pay out of pocket, which is a lot of money. Each year, the hospital has to pay out of pocket. So by reducing these readmission rates, we're going to save them money, because the hospitals are no longer having to pay out of pocket. In the fiscal year 2023, the Hospital Readmissions Reduction Program, Medicare, penalized hospitals for pneumonia readmissions as part of a value-based purchasing program that links payments to hospital care quality. The total cost of penalties was $320 million from October 2022 through September 2023.
Okay, so the only other app that we found was similar to On the Go would be MyChart, and MyChart is linked to Epic, and you're able to look at your test results, schedule appointments, contact your provider, and some similarities and differences are listed here. So for instance, both On the Go and MyChart, you have an after visit summary. In this after visit summary, you're able to access your discharge instructions, but with MyChart, the discharge instructions are what you're handed at the hospital. And with On the Go, we aim to individualize it so you're able to have a broken down form of your discharge instructions. Some differences are individualized discharge checklist. So we're going to tailor our discharge instructions to every patient, and that further goes with the point below, which is we're going to assess like communication and understanding barriers. So for instance, if the person has a 3rd grade reading level, my chart is available in 6th grade reading level. So we're gonna tailor our instructions to the reading level, the cognitive function of our patients so they can get a rounded education. And then we have interprofessional discharge approach. So everyone involved in the healthcare team is going to play a part in discharge instructions. And then our value proposition, On the Go is for hospitals who need to reduce readmission rates related to pneumonia. In order for Medicare to cover these costs, On the Go provides personal discharge instructions and facilitates communication between members of the healthcare team. Unlike my chart, On the Go empowers nurses to deliver a comprehensive approach to discharge, enhancing patient understanding and compliance. So in conclusion, we just aim to reduce readmission rates because the hospitals will have to pay for it if it is within 30 days of them being readmitted. So we aim to reduce this just by giving a better discharge summary, making sure the patients understand, and making sure it's to their level.